Do your patients have pre-existing disease? Do they have obesity? Do they have diabetes, anxiety, depression? Do they have pain? Do they have high blood pressure? Do they have cognitive decline? These are all complicated things. These are all things that cause outcome difference in patients. Of course they do. That's what happens. This is chronic disease. But all of these things can be treated with lifestyle changes. And CareGuard interacts with our Measura protocol to allow improvement in lifestyle. One of the other issues, though, is, you have the best of employees, but are they a liability sometimes? And which one is the liability? How do you figure this out? And that's the key element. One of the things that we want to figure out is, how do we help our patients and how do we lessen our liability risk with potential employees? We certainly hope that we have the best employees in the world. We certainly hope we have the best management team in the world, but that's not always the case. How do we get ahead of this situation? And I'm going to explain how CareGuard kind of helps do all this. Our Measura protocol and our lifestyle protocols with Measura, which is a cognitive enhancement protocol and cognitive improvement protocol, helps us directly with our patients. And the CareGuard reporting system with the QR codes helps us with liability risks with employees, especially EEOC issues, and also helps us with reporting and helps us doing internal investigation and buffers us from some of the actions of management that may not be appropriate for ownership. Sometimes the managers have their own ideas. Sometimes they have a bad day. Sometimes they have a bad week. And sometimes the ownership, because they have multiple facilities, may not be aware of what's going on with a specific manager that week. And that one or two event incident can cause a long-lasting, long-term effect. It'll definitely affect your insurance rates and may even affect your business. And those are the issues that inadvertently show up and can have major issues for organizations. So those are the things I'll discuss. We know that you make a certain amount of money. You know that you have a certain amount of expense. And we know that you expect to have a certain amount of revenue. But sometimes things happen after you've generated your revenue that just, certainly you have taxes, you have sharks that might be litigators, you might lose money to infectious disease, you might even be robbed, not even realizing it because somebody diverts income, or somebody doesn't pay, or somebody doesn't submit, or somebody fibs, or somebody comes up with stories. All of these things take money away from the money that you've already earned, and you might end up being left with pennies. And that's the whole point of CareGuard is, look, let's figure out what these things are. Let's figure out what are the things that are getting money taken away from you so that you have more money left. And at the same time, let's figure out a way to improve the retention of your patients and improve the income that's coming into you so that your expenditures are less, your income is greater. We eliminate this, and maybe you don't end up with pennies at the end. So that's the purpose of CareGuard. It's to improve your entire business process and do it in a way that's safe, and to do it in a way that really aligns you with the best possible outcome for your patients. So CareGuard is a bunch of different aspects to it. It deals with compliance and accountability. It deals with risk management. It deals with producing excellence, and it brings in the best possible protocols that we can do. It's used to guard the patient safety. It's really to uphold ethical standards. It allows a continuous method for assessment and monitoring, reporting, and documentation. And it does this in a way that it's not just like when the JCO inspection is occurring or just when some external inspector is coming. It does it in a way that the patients are seen in a routine basis, on a monthly basis, that someone comes in, takes a peek at them, and also is looking at the facility and does it in a non-confrontational way. So you get real data. You don't get just that perfect pillow fluff every once in a while. You're actually getting what's going on with your patients in real time, all the time, and you're getting a reporting mechanism that really helps. I'm going to dive into these issues, but that's the overall purpose of CareGuard.